Everybody. Happy Friday Eve. We're going to get kicked off here. Thanks for joining. I know that you guys' time is valuable. We have what our boss calls the Super Bowl coming up, so we just wanted to kind of reach out, get a little information to all our brokers. I'm sure you're going to hear this throughout the entire presentation, but really thankful for what you guys do. Guys and gals do for us, really drive the Sharp name and help us out, any way we can. So hopefully this presentation gives you a couple more tips, tricks, something new that's going to be going on for the new year. Let me get to the next slide here. And since our boss Don calls it the Super Bowl, I'm going to kind of stick with the old football theme here. So in the booth with me today is Cheryl Cody, Joanne, Cheryl Cody, obviously with small group. I got Joanne with Sharp Community Medical Group. Jonathan is a sales associate here, new on our team with Sharp Health Plan. Roberta with Sharp Steely, and then Georgina Herrera and Trisha, again on the IFP team for account executive. So we'll start off, let's say the first quarter here, going with IFP. We'll kick it to Cheryl then for the small group presentation, have a little halftime break, go to Joanne and Roberta then for the third and fourth quarter, and then Jonathan's going to have some closing remarks as we end. So with that said, I think National Anthem has been sung. Everybody's on the field. We're ready to roll. So I am going to kick it to you, Trisha.
Hello, everybody. My name's Trisha. I'm an account executive here, and it's nice to see so many familiar names today. First things first, we're going to start with some highlights of the one and only Sharp Health Plan. So the health plan was established in 1992, and this year we're celebrating our 30-year anniversary. We are the only locally based nonprofit commercial health plan serving San Diegans of all ages. Our unique integration with Sharp Healthcare allows us to connect our members to an award-winning network of hospitals, medical groups, and physicians. We're San Diego's trusted healthcare partner and advocate, and we're committed to delivering the most value for our members. Next slide, please, Sharp. We're proud to say that we're the highest member-rated health plan in California for the 8th year in a row. This is such an honor for us because it's a quality recognition, and this motivates us to keep on being the best we can be for our members. Next slide. And here we have some more of our awards and accolades. Not only are we the highest member-rated health plan in the state, but one of the highest in the nation. We've earned the highest ratings from the Office of Patient Advocacy in terms of medical care and overall patient experience. We continue to score top ratings with Covered California, and in the Union Tribune Readers Poll, we were even voted San Diego's best health insurance. So we're honored to receive this recognition and to serve the San Diego community. With that, I'll turn it over to Georgina, who will continue with more on our networks.
Thank you, Trisha. So I'll be covering a brief section on our network and access to care. In our network, we have more than 1,800 doctors, more than 40 urgent care locations, and more than 450 pharmacies. In addition, we have many clinics nationwide, 13 hospitals, and 7 medical groups. As Trent mentioned, our medical group specialists and representatives will present in detail the differences among the medical groups. However, I did want to specify what medical groups are part of either Premier or our Performance networks. Do note that the Performance Network is a bigger network that includes all the 7 medical groups listed on the slide, while our Premier Network only includes Sharp Steely and Sharp Community Medical Group. Similarly, the Performance Network includes all the hospitals listed on the slide, while our Premier Network doesn't include the In-Valley, Rancho Springs, and Tri-City Medical Centers. Next slide. And then, so some of this information I just covered, which is the urgent care in the hospitals, and some of this information I'll cover on the next slides. However, I do want to touch on the emergency travel services and our pharmacy partners. So as you can see, the pharmacy partners includes Walmart, Target, Walgreens, Costco, CVS, and much more. For the emergency travel services, our members are covered for urgent care, emergency room, and hospital emergency services outside of San Diego. We do partner with Assist America, who can connect our members to doctors, hospitals, pharmacies, and other service providers. They can also assist with emergency transportation, lost documents, interpretation. It is more comprehensive than just the medical benefits. Now on the next slide, I'll cover the after hours nurse line, the minute clinics, and the care that our members can receive via video or phone. So first off, our members are able to receive after hours and weekend medical advice from a single phone call by our specialty trained registered nurses. And then when members need access to convenient care to treat either a minor illness or an injury such as an earache, they can visit a CVS Minute Clinic. These are walk-in medical clinics inside selected CVS pharmacy store locations that are nationwide. And then lastly, we partner with our medical groups to make telehealth services easy. Keep in mind that each medical group has their own platform that they use for this service, but you can find that information on our website. And then finally, our Best Health program is available to all our members at no extra cost. So this program offers a robust online wellness tools, interactive workshops, one-on-one health coaching, and more. From national board certified health coaches, our members can receive the support that they need to fulfill their wellness journey. In addition, Sharp Health Fund members can receive discounts on alternative care and wellness products through Choose Healthy. Now I'll pass it back to Trent.
Awesome. Thank you so much for that, ladies. We'll get into just kind of the end of individual and family plans here. Easy to get a quote. Obviously, you can call us. We've got online options as well. This is through Cover California or through sharphealthplan.com. Definitely wanted to point that out here. Kind of the next slides are really good, just informational. I don't know if you want to take screenshots for this. We can definitely get it out to everybody after the presentation, but just want to kind of explain the link. If you want to sign up, obviously you can go to sharphealthplan.com. A lot of brokers don't know this, but you can actually get a personalized broker link as well. Most of you, I think, on the call probably have that. If you do not, definitely give us a ring. We can send that out to you, and that'll just be a link that shoots them straight to getting enrolled, but it'll automatically attach you as the broker. So wanted to mention that. Proof of residency, you know, that's what we'll be looking for here in open enrollment. Give us, send that into ifpsales@sharp.com is going to be the best email. You can, of course, contact us personally here as well if you've got those individual emails. And then, of course, billing. Most of the time, the questions for billing are going to go to the billing department. We always like to point that out. I mean, they're the Navy SEALs of billing over there, the 8121 number. So wanted to definitely review all that for you. Commission rates this year, first year enrollees still 5%, 4% for renewal year enrollees. Thanks again. Obviously, I know we're going to say this throughout the thing, but throughout the presentation, but we value the partnership. We try to keep these commissions rates, you know, the highest throughout the industry. That way, you know, we reward you like you should be. More helpful links, payment portal we've got there, sharphealthplan.com. /payment. Any of the members need to make payments, make changes to their account. That's always on there. We do have a broker center. We sent cards out for this last year and want to make sure that you see that again, but all kinds of resources there. If there's anything missing, of course, call us here at the IFP sales line, but forms, resources, downloads, anything you need, even more on that wellness program, which is awesome. And then the get a quote, which we mentioned, you know, a couple slides before this. Any information you might need, all gonna be on there. So very, very good. Let me get to this here. We got more reminders, departments to remember. Obviously, us here at the IFP department, there's our direct line. You have our email. You got billing there. 8121 is going to be their last four. Customer care, we can't do any of this without customer care. They're they're so great over there. Anything they can't answer, definitely you can come to us, and sometimes we even go to them. So we work hand in hand and want to make sure that everybody gets the right information and gets where they need to be as far as plans are concerned. We have the small and large group department number there. And again, Cheryl's coming up next, so she can dive a little bit more in detail to that. But hopefully you're getting screenshots of this. These are great resources for everybody to have. If you are not, we can definitely just contact us after the event. We can get this information over to you. Sounds good. Perfect.
Our lovely team. Yay.
Our lovely team. It's great. So IFP is done. First quarter is over. We're going to head to the second quarter here for Cheryl. Hall of Fame, Cheryl Cody.
Oh, Hall of Fame.
Hall of Fame, that's right.
And Ricky's on the line, so Boston's in the house.
Awesome.
Do you want to just say,
Cheryl?
I sure will. Hey, there was definitely some chat going on about what we have going. You know, so just make sure we're keeping an eye on the chat. I don't know if we want to do that at the end of
let's do
it at the end.
We can definitely do that. Let's we got I don't want to get a delay of game penalty here, so let's make sure we're still at 15 minutes for IFP.
Okay.
And any of these questions, if you've got questions, definitely put them in the chat. If we don't get to them in this meeting, we'll answer them all after the presentation. We'll send out a mass email. That way they definitely all get sent out.
Yeah.
Copy of the slides. We can try that for you, David. And then over team 2. Any other questions we got on here? Fun fact, but we'll definitely get these. I see Ricky's. We'll definitely get Ricky's questions answered.
Yeah.
But since we're getting close, let's get it over to Cheryl.
All right. Thank you.
And go from there.
Okay. Thanks. You want to flip to my slide real quick?
There we go.
All right. Well, I definitely see a lot of names up there. I don't see anybody's faces, but welcome. I am Cheryl Cody from the small group department. You're a salesperson. Been with the company for 12 years. I can hardly believe it. You know, one thing that I would like to add about small group, for those of you that do write small group, as well as even individual, you know that we have we're consistent. So everything that we do is super consistent. Our rates, our networks, our plans, we are the most consistent in the market. In small group, I say I have 25 plans. You name the plan, I have it. Co-pays, co-insurance, HSA plans. So I do have 4 networks in IFP. We only have the Premier and Performance. Through Covered California with Sharp Health Plan and Cal Choice, it's only Premier and Performance, but we do have additional networks in small groups. So if you come to me directly, I have access to other networks. I always say we're super simple, mix and match any plan you want, mirrored, non-mirrored. You don't have to touch metal tiers. You can offer a platinum and a bronze plan should you choose. Commissions flat commission 5% for our non-mirrored plans. Those are our NG plans. Mirrored plans, we are at 6.5 sliding scale, so it slides down until year after year until you hit 5. That is the highest in the industry, so I'm very, very happy to share that. And I can work with you on which plans, if you don't know mirrored versus non-mirrored. We are simple in our plans that we can offer and how many, 1 through 5, 1 network, 2 plans, 6+, 2 networks, 6 plans in each network. Not that anybody's going to write 12 plans. However, you have that ability. We are wrapping with other carriers. Oftentimes we are going alongside a Kaiser. Sharp just needs 5 employees enrolled on our plan. And we can write alongside multiple carriers. Carve-outs, I actually just wrote a 12-person carve-out, which is kind of cool. So it would be non-union employees, hourly versus salary, executive. I just need a minimum of 5 employees enrolling. So we are the only carrier that has that option. So if you think that a carrier, or I'm sorry, if a group really just wants to focus in on offering benefits to certain employees, we have that ability. I'm so happy for my next piece is my submission. No DE9C required for groups 5 or more. All I need is an app, a check, an app that means master app, a check or a ACH, as well as the employee enrollment forms. If it's under 5, then I do need a DE9C, but I still do not need waivers. All I need is the DE9C to say why somebody is waiving coverage. So super simple, super easy. If you have questions, always reach out to me on that. I just think it's an easy way to enroll new business. Participation, 5 or more. We only need 25%. Again, I don't even need to show waivers. Groups under 5, it is the 60% rule. Valid waivers, I have them listed out here, but it's your typical waivers. However, cross-border plans for Sharp in large group and small group, so your MediExcels and SIMSA, those are valid waivers. So super easy. I could take 2 people, so I could take the owner and the HR person, and then I could have 25 people that are on MediExcel. Keep that in mind. Something else that's new that we just got last year is PEO. So yes, we can take a group that's leaving a PEO. However, if a group decides to stay in the PEO, but they don't want to offer the PEO's benefits, Sharp Health Plan will write that group. I think that is something that we are seeing a lot of access and new submissions on. And then Trent, I'll have you flip on over to the next slide. And I will say this is my very favorite slide. And again, you guys see this, you know this, we breathe it. I've been here for 12 years and we are tracking it just about a 5% trend over 12 years. This is just kind of showing you year after year what our consistency looks like. Many of you know once a group comes with us, they stay with us purely based off of our plan and rate consistency. So we're looking at a very small increase for 2023 Q1. And then I'll close out with our team of people in small group. Always feel free, if you guys have questions about account management or you don't know who to contact, always contact me. I am available. There's my email. Many of you already have my phone number and cell phone number. So that is it. And if there's questions, I can do those at the end. And that is it for me. Thank you.
Perfect, Cheryl. Awesome. Thank you so much. We're ahead of schedule, doing good here at halftime. Joe, are you sure you don't want to do a halftime show for us or sing? No?
No, I'm still preparing for the raffle, so.
Okay, all right. That's good. Okay, up next, then, if we got no halftime show, in football terms, these are noted, called the GOATs, right? So the greatest of all time. We got Joanna and Roberta come up in the second half, and I learned something literally every time these two come and join us. So I'm very excited. We will start with Joanne, and I will pass it over to you, Joanne, to get us started.
Sounds great. If you can pull up my screens. First of all, I want to thank all of you for inviting Roberta and me today. We love presenting to you and giving you as much information as we can to help your sales efforts. As we all know at Sharp, we serve the community, and listening to the community in 1989 is why Sharp Community Medical Group was formed. And we have grown to be the largest independent medical group of affiliated physicians in the county and one of the top 5 largest groups in the entire state of California. Next, please. Thank you. So at Sharp, we're very fortunate, and you're very fortunate as sales account executives, that you really can offer your prospects anything that they want, because we have everything that they might want. Sharp Steely, Roberta will go into how that centralized model works. Sharp Community, answering the surveys in the community. We are a community model, and that's what I'm going to, thank you. That's what I'm going to talk about a little bit today. With the community model, you can build your own network of care close to your home, close to your work, close to your school. With a community model, at least the Sharp Community Medical Group model, you are able, and your doctor is able to admit you to your nearest Sharp hospital or your nearest Palomar hospital as well. As I mentioned, we've grown to 1,000 doctors in over 350 locations. We have 700 specialists covering over 30 specialties. So if you have an employer that might have an employee or a member, a team member that has some really challenging health issues, you might want to look at all of the specialties for them and helping them choose their doctor that we can offer, because we have the largest amount of specialties within all the medical groups of Sharp. We have over 21 contracted urgent care locations throughout the county. So wherever you live, there's probably an urgent care within 10 minutes of your residence. And all your laboratories and other ancillary services are in your community. I like this little visual aid where it starts with your primary care and your specialty doctor. And then of course we have all of your ancillary, your labs and things. My guy's lab is right next to his doctor's office. Doesn't even have to get in his car. Doesn't have to even walk down a hallway. Walks in one door and out the other. And then, of course, we have the CVS Minute Clinics are in our network, where your members will pay the same copay as they do for a primary care doctor visit. And that's very, very helpful to a lot of people who just need a little something for an earache for a child, or maybe a little sore throat, that type of thing. And then, of course, the hospital. And my favorite little thing is that X-ray waving to all of you, because I like to do that. Next slide, please. Thank you. So we have the care, not necessarily when you need it, but where you want it, because you can experience the difference of high quality personal health care close to your home, your work, or your school. 5-10 minutes away. I always tell people, if there's a medical building at the end of your street, there's a very good chance there's a Sharp Community Medical Group doctor there. We have the largest service area in the county, and I'll show you that in the next slide. We have virtual visits with your doctor, virtual urgent care through Mark Urgent Care, and we have after hours cares, not with doctors on the phone, not with nurses on the phone or NPs on the phone, but actually primary care doctors that are on call 24/7. And if you have members that have children, through Sharp Community Medical Group, they can see children's physicians medical group doctors that are throughout the county. They have, I think, 20 or 30 locations, and they admit primarily to Rady Children's Hospital for pediatrics. And as a mom, even though I'm an old mom, I remember that great pediatric care is really the most important thing. Next slide, please. Thank you. So this is our network map, and this really tells the story, because we have the largest footprint of pretty much any medical group in the entire county. We work in southern Riverside County, Temecula and Murrieta. We go all the way west from Encinitas and Oceanside all the way to Imperial Beach, the inland along the 15 and 67 corridors, south to the border, and east to Campo, Alpine, and Julian. So we have doctors' offices in all of these areas. This is a great legend, and it's a great sales aid when you're talking to an employer or you're talking to a prospective member as well. Next, please. Thank you. So this is just a brief recap about our convenient access to care. We have virtual doctor visits. The majority of our doctors have the Follow My Health online portal. We have virtual care. Of course, you can see your doctor in person. Our doctors, and this is a challenge that the entire healthcare system in San Diego has, is access. And I'm sure you've all heard that too. And we really do have very good access, and I'll cover that in a couple of slides. We have the walk-in clinics with the Minute Cares, urgent care in person or virtual, and all the emergency rooms are in network. So in other words, if you go to an emergency room, say in Coronado or in Grossmont, you can be admitted to that hospital and taken upstairs, and you won't be moved to Sharp Memorial in Kearney Mesa. So all Sharp hospitals and both Palomar hospitals are in network. And we use access a lot, but I've learned from dealing with seniors especially that access is kind of ubiquitous, but people understand in-network. And next, please. Thank you. So we've learned last year in 2021, leadership, they did a survey with patients about, and also with leadership in the hospitals and in the med groups about what were the patients saying. And Chris Howard got back to all of us and basically said, they're still confused about what's the difference, you know, what are the differentiators between the two med groups? And so one of the biggest differentiators are hospital admissions. And so my team leader, Todd Mills, put this slide together. And this is really important because when I'm qualifying a patient, I ask, where do you live? Where do you want to go to urgent care? And if need be, where do you want to go to the hospital? And those three questions really can put you down the right road. And so for hospital admissions, Sharp-East-Ely is that centralized model. So mainly in-network, their in-network hospital is Sharp Memorial. Sharp Community, because we're the community model, all Sharp hospitals, all 4 acute care hospitals and the 2 Palomar hospitals are in-network. For surgical procedures, Sharp Memorial is the centralized hospital. They do some things at Sharp Coronado, but that is an out-of-network referral. Sharp Community surgical procedures can be done at all Sharp hospitals because they're all in network. So your closest hospital can be your hospital, and Palomar hospitals in Escondido and in Poway. For maternity hospitals, because we actually had a survey recipient say, I live in South Bay, why can't I have my baby at Sharp Chula Vista Medical Center? Well, Sharp-East-Ely patients, their maternity hospital is Sharp Mary Birch. For Sharp Community Medical Group patients, their maternity hospitals are Sharp Mary Birch, Sharp Grossmont Hospital in East County, and Sharp Chula Vista Medical Center in South Bay. Next, please. Thank you. Now, Sharp Care Medical Group is a subset of Sharp Community Medical Group. And these doctors are primary care doctors, and they have wonderful access. If you have somebody who needs really, you know, they want to sign up, but they really need to get into the doctor, these doctors have great access for in-person as well as virtual visits. So they're all accepting new patients, and we have offices in Coronado, East Lake South Bay, La Mesa, Kearney Mesa, Spring Valley, and serving Santee inside the Lantern Crest Senior Living Community. Now, all of these offices are south of the 56, just to let you know. North of the 56, we have Arch, Graybill, also now being known as Palomar Health. They have virtual visits, of course, same-day visits available. They keep an opening on their block. They admit to your local Sharp hospitals. They all participate in Follow My Health, and of course they accept all the insurances. Now, we have grown Sharp Care medical offices. La Mesa Family Medicine has joined Sharp Grossmont, which is right across from Sharp Grossmont Hospital. And now Dr. Ancona Young, she's a DO, which is becoming very popular in San Diego. Dr. Ancona Young, Dr. Andrew Brown, and Dr. Mookie, his name is Heidi Yuki. Dr. Mookie is there. And Dr. Mookie is relatively new to Sharp Care and Sharp, so he's got great access, and he's just a vibrant, energized part of that team. In Spring Valley, Dr. Fox has now been joined by Dr. Abida Fayez, and Dr. Fayez in Spring Valley is also a DO. The doctors in Kearney Mesa, which are right across from Sharp Memorial, are Dr. Burgess. He was a physician on an aircraft carrier and the medical ship with the U.S. Navy. So he brings a lot of discipline and care in that regard. So that's sometimes interesting for employees and members and prospects. And then in Coronado, we have Dr. Warm, Dr. Wong, and Dr. Owen. They will be getting a new doctor October 1st. I don't have the information on that yet, but these are wonderful offices. They're under the Sharp umbrella, and they have great access, and they are all accepting new patients. Next, please. Thank you. So one of the things that we've learned over the past few years is that a lot of agents don't understand all of the support that we give their patients, their members, and our doctors. And this is one of the reasons why we've grown and we have so many doctors and medical groups coming to us to join Sharp Community Medical Group because of this support. We have a lot of programs for chronic illness, complex case management, disease management, medication therapy management, which I've learned working with seniors can really be a challenge for a lot of seniors. We have post-discharge care coordination, transplant case management, and we actually have inpatient teams at the hospital, and they're on-site hospitalists and nurses who coordinate services with the patient's primary care physician and, of course, the family and the loved ones. We have educational programs through Sharp Healthcare. They're still virtual. Hopefully, they'll be going live soon. And one thing that I've really learned about, because I've happened to have a couple of back surgeries in my past, is that we are connected with the Spine Zone. And the Spine Zone has 8 locations throughout San Diego County. And they use all of the latest technique from ice to heat to laser, all these techniques to help with back pain, neck pain, cervical pain without the need for surgery. So it's a very popular and sought out clinic for people who are just don't want to have that back surgery or are trying to avoid it at all costs. And so as you can see by the wheel on the left, it all is based on the hub of the primary care doctor and the patient. Next, please. Thank you. So there's a few things new. And one of the things that we have new is our urgent care brochure has been updated, but not only is it in English, now it's in Spanish. So if you have a member that would like that, we have that in Spanish for them. I have sure gone through hundreds of them with agents who, once they found out about it, said, can I have 50 of them? Because I want to give everyone I talk to that I talk to in, my community a Spanish urgent care brochure. Now, we've also created this QR code, and you can either scan the QR code or you can type in the URL scmg.org/4-brokers into your browser, and there you can download all of the SCMG collateral to support your efforts. Sharp East Ely and Sharp Community, we always have physician directories, but I'm sure Roberta would agree with me that the latest and the greatest will always be online, because we upload our doctors when they get credentialed within 7 days. Like every Tuesday we update it. So that's always where you can get the latest and greatest. And we ask you to visit regularly, because we'll have our new fall directory of primary care physicians coming out before AEP. And of course, you can always call me. And I'm going to reach out to Trent, because I'd like to drop a stack of these off for you, physical stack, because agents I have found keep them in their binder and just scan it on their phone right when they're in front of someone. And it's so helpful. But all of the collateral that we have, our access to care piece, our in-network hospital piece, where it shows you what hospitals are in network, the physician directory, the urgent care brochures are all right at your fingertips with the QR code here. And next, please. And I just want to leave you all with a great quote that I know if you're in sales like I've been for 30 some years, you understand it. always deliver more than expected, and you'll always close the deal. And that's from Larry Page, co-founder of Google. And I'll hang around in case there's any questions, but thank you guys so much for having me today.
Thank you so much, Joanne. That IFP team, we're gonna have to pick up our game. I love that QR code, especially having it on cards for people so they can scan it and get that information. That is that's a great idea. So we're gonna definitely have to work on that. So time is looking good here. We're moving right along in the game. We got Roberta Curry up next for Sharp Reese Steely. Roberta, if you are ready to go, I'm gonna kick it over to you. I don't see any questions right now, so we're looking clean on that side of the game. But Roberta, take it away.
Great. Thanks so much for letting me join you today. I'm really excited to be able to share information about Sharp Reese Steely. And Trent, if you could forward the slide, there we go. So at Sharp Reese Steely, we deliver coordinated care with the Sharp experience. Next year, we're going to be celebrating 100 years of providing care within San Diego. We're really excited about that. And I think it speaks to our quality and the fact that we are able to deliver that Sharp experience, the fact that we've had that longevity, that we've had that involvement in the community for that whole time. Just to let you know, I am the account management and outreach for the Sharp Reese Steely Medical Centers, and I handle group health and I handle Medicare as the Medicare specialist for Sharp Reese Steely. Next, please. So Sharp Reese Steely has been delivering that clinical excellence since 1923. And it's really great when you talk to people and they say, oh yeah, I was born at Mary Birch. My family has been going to Sharp Reese Steely. You know, my mom went, now I'm going. And then you have, you know, younger members also looking to get that great Sharp Reese Steely experience. We do have coordinated and comprehensive care, and it includes primary and specialty care, urgent care, pharmacy, physical therapy, lab, radiology, all under one roof or nearby, which I think is a key thing, especially when you're talking about families. They just have to go to one place and kind of get everything done. Or when you're talking to seniors and they're not having to go to multiple places, they're able usually to go to one place and get all of their services. Next, please. So here is our mission. It is to improve the health of the community through a caring partnership of patients, doctors, and our employees, and we set community standards and exceed expectations in a caring, affordable, and accessible manner. And I want all of the agents to know, if you've never been a Sharp Reese Steely patient, that Sharp experience is real. And I'm sure Joanne can tell you the same for Sharp community. There is something very special that Sharp has to offer for our folks in the community. Next slide, please. Now, with that Sharp experience, it is not just one thing, it is everything that we do, and it's our care philosophy that we treat people not just as patients, but we treat them as people, and we are transforming the healthcare experience for the entire community. We combine clinical excellence, advanced technology, and compassionate care. One of the key things that I want to mention is that we have been expanding our Otay Ranch facility. And I'm not sure if you've been there recently. We're adding almost 70,000 square feet of clinical space. In April, we opened our new mammography unit there, and we have additional providers and services, and we will also be opening urgent care at Otay Ranch in Chula Vista. So just to let you know, that is going to be coming within the next year, year and a half. And we are continuing also to have additional parking provided. Parking is free there. I know parking, it sounds like it's such a small thing, but free parking sometimes can be a real driver. So just to let you know, there is plenty of space to park there, and it is free. Next slide, please. Dr. Martin is one of our great physicians here at Sharp Reese Steely, and I do want to include this quote. I came through it the other day. We were talking about some of the different work that he's been piloting, and I think he really encapsulates what many of our providers are, really kind of living and working by. I strive to do my absolute best for every patient, every visit. And I think that that speaks to the trust that people have with their Sharp Reese Steely doctors. And it also speaks to that quality. When they come in, they know that they're going to get great care, and they're going to get it in a way that it treats them as a person, not just as a number. Next slide, please. So here are our numbers. We have more than 700 primary and specialty care physicians, nurse practitioners, and advanced practice providers. We have 19 different clinics all throughout San Diego, and we have 5 urgent care locations. We're soon to have another opening at Otay Ranch, and we have 8 pharmacies. So we do have lots of access to our services, again, directly on site or very close to. We have approximately 2,700 dedicated employees, and being a Sharp Reese Steely employee, I've been here 16 years, and I've worked kind of through different areas of the system before I started this position a couple years ago. And I will tell you, there is a great feeling, and I think when you come into an office as a patient and you experience that the people that are there are working well together, that the clinicians and the staff are working well together, it gives you a kind of a warm, welcoming feeling, and it sort of puts you at ease. You're not always feeling your best when you come into the doctor's office, and I think that's one of the key things that Sharp Reese Steely can offer, is that kind of welcoming and sort of, I don't want to say relaxing, but I do want to say that coordinated feeling between physicians and staff, as well as with the patients, to try and get them to feeling their best. Next slide, please. Now, for Sharp Reese Steely, we do offer, again, most of the care that you need under one roof. We offer virtual visits with the patient's own doctor. It's not just a random doctor, it's the actual physician. We do have in-person and virtual urgent care visits, even during the holidays, which I think that's a key thing. It never fails, especially if you have kids. Somebody's going to have something, they're going to have an earache, a sore throat, something, and you'll have access to that urgent care. One of the key features of Sharp Reese Steely Urgent Care is that when you go into urgent care, they have access to your Sharp Reese Steely chart. So they can see all of the medications that you're taking. They can also see hospital records and pull those, so that the person that's going to see you, even if they're not your everyday doctor, they are going to have access to your primary care physician notes, specialty care notes, as well as your medications and your medical history. And I think that can be a really great feature for folks that are trying to share about Sharp Reese Steely, to let people know that they're actually going to have that chart available when they do go into urgent care. We do have after hours and weekend appointments available, and we do have nurse advice that's available 24 hours a day, 7 days a week. You just pick up the phone, you call, and you're going to get somebody. We also do have the Follow My Health portal, and I think that's another great feature, especially with busy working families and also people who are helping to take care of seniors, that they can log into Follow My Health and they can look at lab results, test results. They can send messages to the care team and to the doctor, communicating either about their children, or maybe they're helping to care for an older adult, or for themselves, especially sometimes if you're really busy, calling between that 8 and 5 period can be a challenge. Knowing that you can go home and send a message at your convenience to communicate with your care team can be great, especially if it's for something kind of routine like medication refills or something. And also, we do have after hours pediatrics, and this is something where you can call, be seen after work. You get home, your kiddo has an earache or there's some other sort of thing going on, you can call and be seen by a pediatrician within Sharp-Reese-Steely. So I think that's also something that might be really important when you're trying to talk to people about signing up with Sharp-Reese-Steely. Next slide, please. We do have a great Be Well program, and it offers supportive care in several areas, including our weight management, our smoking cessation classes, diabetes care management, and individualized health plans. And by individualized health plans, we mean how can we help people to meet their goal? Maybe they feel like they need relaxation techniques. Maybe they feel like they need help with their overall well-being, trying to figure out maybe how they coordinate what they eat and daily exercise and some other things. I don't know if you've ever had an opportunity to meet one of our health coaches, one in particular that has come with me on some of our on-site events. Her name is Desiree. She's amazing. And she has such a great way with people. She meets them where they are. Right? There's no, there isn't any scolding or anything like that. It's an invitation. How can we help you? You know, for things like better sleep and all that. So that is something that we offer. Next slide, please. We are a trusted resource for San Diego. We have had over 1.4 million physician visits, over 2 million calls that we handle through our call center. We have filled over 300,000 prescriptions for eyeglasses. About 5 million tests have been run, about 280,000 radiology visits, nearly 60,000 occupational medicine visits. And that's another thing. I'm not sure if you know, but Sharp-Reese-Steely does have a great occupational medicine department. We have 5 different locations for occupational medicine, and we are able to not only handle employer-based services like DMV physicals and drug screens and also pre-employment physicals, but in occupational medicine, they can treat work injuries as well. So just to let you know, that is a really nice kind of partnership that we have within Sharp-Reese-Steely. We have been treating about 23,000 patients that have diabetes, and we've, I'm so sorry, we've dispensed about 12,000 eyeglasses. And I do want to speak about diabetes because that has been one of our key goals, is getting our case management and population health coordinating to handle patients that have diabetes or high blood pressure. We have a very large department here, and they spend all day long doing outreach all throughout our Sharp-Reese-Steely system to touch base with our folks to make sure to see if they are having food insecurity or if they're having other issues. Again, not just treating the patient for their condition, we're treating them as a person. Next slide, please. Sharp-Reese-Steely, we are clinical recognized leaders. We did, like Sharp Health Plan, we were very fortunate to be voted as San Diego's best for 2021 for the medical group, for our audiology, hearing aid store, laser eye center, pharmacy, and our weight loss clinic. And that was a really great thing for us. That's our community telling us that they like the service that they get from us. We do have a series of different accreditations and recognitions. We do have the Stage 7 status from the HIMSS, top 10 in patient experience from the Integrated Healthcare Association. We're accredited for AAAHC. We've had the elite status for 12 consecutive years from the American Physicians Groups, gold status for our blood pressure control. And again, that is due in part to our case management and also our population health. And we've received full recognition for our diabetes prevention program through the CDC. So lots of great work that's being done to help keep our population healthy and to keep our neighbors and our friends healthy all throughout San Diego. Next slide, please. So to get started, you folks will choose a family medicine or internal medicine doctor close to their home or to their office. Again, we do have those 19 different locations throughout San Diego. To learn more, you can either visit sharp.com/SRS doctors, or you can call the 858-499-2600 between 7 and 7. We do encourage every new enrollee to enroll in Follow My Health. I think that can really kind of augment their healthcare experience, the fact that they're going to have access to their care team to be able to communicate and also to receive communications from their care team. Next slide, please. So my name is Roberta Curry. I am the Account Management and Outreach Executive for Sharp Sealy Medical Centers, handling group health and Medicare. If you would like, I'm very happy to send a special link that I have. I also have a QR code. I didn't include it in the presentation. And I've also got a really nice flyer that includes all of our different locations. I am very happy to either send it on to Sharp Health Plan, or if you would like to contact me directly. And in particular, if you have somebody that you are looking for a primary care doctor at a certain location and you'd like to learn a little more, you're very welcome to contact me directly. If I haven't had the pleasure of working with you before, I will tell you that I really like to provide one-on-one support to make sure that you're able to give your clients what they need when they need it. So thank you so much. And if there's any questions, I know both Joanne and I would be happy to answer any questions that you might have about our prospective medical groups. And thank you so much to Trent and to Sharp Health Plan for letting us come in today.
Awesome. Thank you so much, Roberta. So much information. Like I said, every time I listen to you two, there's so much information. It's awesome. So any questions anybody needs, definitely you know where to find us. There's been all kinds of slides with emails and phone numbers. So all kinds of resources at your fingertips. And with that said, we're at the end of our game. Is anybody tired of the football puns yet? I think I'm even starting to get tired of the football puns. But I got one more. So first, let me thank Cheryl. Let me thank Tricia, Roberta, Joanne, Joe. I know you guys are busy, so thanks for taking the time. And obviously, our broker community, we can't do without you. It's just the bottom line. So now we are done up here in the booth. We're going to send it down to our sideline commentator, Joe, who's got the post-game wrap-up and maybe some awards as well. So Joe, take it away.
Thank you very much. I wanted to thank all the presenters who shared all this information, and thank you for attending. I thank you all the brokers for attending. I have actual raffle going on for all the attendees, and I wanted to get everyone into this raffle. I actually arranged a spreadsheet with everyone's name that attended. So I have 10 gift cards, 10 $100 gift cards to target. So I'm going to go ahead and read off this list, and I'm going to kind of select them randomly. It's not, I'm going to do
Am
it
I in the list? Am I on the list since I'm here?
I didn't include you on the list, but I'll treat you
okay.
separately.
Okay. Well, if Ricky Hayshaw wins, I'll be sure to hand deliver his in person.
Yes. Okay. Let me add. Let me update one thing here, and then awesome. So first winner is going to be David Cravens. David, I'm going to write him down.
And thank you, David, for that wonderful submission. Very, very blessed. Thank you. Thank you. He's been a great partner for us and with us.
Next winner is Jim Lother.
Jim. Yay, Jim. Seriously,
then,
I'm just sitting here like looking at everybody's name, and it's just great.
Lou Fatohi is the third winner. Louis Fatohi. Next winner is Timothy Thompson. Andrew Tomsky is the fifth winner. Next is Frederick Menslage. Sorry if I change that. Frederick is the next winner for number 6. Jamie Villavicencio. Lawrence Chen is the 8th winner. Katia Montanez. And the last winner we have is Maureen Moran.
Awesome.
Thank you everyone for attending. We appreciate you all.
Perfect. Thanks, everybody. Thanks again. We got Super Bowl coming up. If you need anything, you know where to find us. We'll go from there. Have a good Friday and weekend. Goodbye.
All right, make sure we just review the chat, Trent, because we just got another question.
We have some questions.
I don't know if we want to do this now or we can address those separately. I know our time is kind of running out, so why don't we plan to do that?
Yeah, we can definitely do it. We can definitely do it separately, and we'll get in touch with any of the questions that are on here as well.
Yeah.
Sound good?
Thanks, everyone.
All right.
Thank you
All
very
right.
much.
See
Have
ya.
a great day,
Bye,
everybody.
everybody.
everyone.
Congratulations to our winners. Thank you for your time.
Bye.
Let's rock
Bye.
this
Thanks,
next
everyone.
open enrollment period.